how would you allay patients' fears around the use of AI? So like you mentioned ChatGPT, that's going to a third party, that's going somewhere. I don't know if that's violating HIPAA or how that sort of works, but maybe let's start with Lane. How would you allay your patients' fears around the use of AI?
Yeah, so I mean, coming from a physical therapy background and obviously surrounded by some, brilliant speech therapists, patient education is huge, right? And kind of like what Izzy was saying, what are your concerns? A lot of times I just ask people, see what their, concerns are, see what they're actually worried about. It seems to me if you really hit home on, this is HIPAA compliant, at the end of the day, this is something that's a resource. I'm using it to help me treat you in a better way, but also it's just a resource for me, right? It's there to supplement what I do and augment some of the tedious processes that we may go through in order to enhance the patient interaction. I think a lot of people are concerned about when they hear AI, they think robots, they think computers, and they assume that that's going to lessen the human interaction that they're going to have with me as a clinician. But in my experience, I think it actually enhances the patient and the human interaction. I actually did a little bit of a, what do you call it? Just an informal poll with patients that I see for about the past month or so. And I have 51 responses. And my question was, would you be open to allowing ambient AI documentation in order for me to get my head out of this tablet, get my finger off this keyboard and, treat you one-on-one and have my full focus of my attention? And out of 51 responses, this is an informal survey poll, but out of 51 patient responses, all organic responses, 81% said that they would be open to doing that in the East Tennessee region. Only 9% said no, and then 10% were indifferent. So that was really shocking to me in a way, because I get excited about AI. I can see the benefits to me for a clinician as well as the patient. But to see that it's really not as taboo as we all think it is, I think was pretty awesome and eye-opening. So the way I allay the patient's fears is I just, I talk to them. I tell them that this is a resource for me. This is something that's just there to support what I do and enhance what I do. And a lot of people are fairly open to that.